Alzheimer's is a disease which makes you forget things and affects your cognitive thinking. Today, we have renowned neurologist Dr. Priyabata Naik with us. So let us know from him the causes and symptoms of this disease.
Forgetfulness is the first sign of dementia and mostly Alzheimer's dementia. But forgetfulness is not only dementia. The thing for forgetfulness is known as amnesia. But forgetfulness to the extent that hampers the day-to-day activity of a person is known as dementia. That means the person was doing the same things before, but due to forgetfulness, he is unable to do the same things. He was doing marketing, he was going to market, he was do all the shopping, he was able to do the calculations. But now, due to forgetting the things, he is unable to do those kind of stuff. That is known as dementia, and it is most common in Alzheimer's dementia. Alzheimer's is divided into three stages: mild stage, moderate stage, and severe stage. The symptoms depend on the stage of dementia. In the mild stage, the persons have naming difficulty. They will have difficulty in naming objects and also names of the family members. Then the persons have recent memory loss. Recent memory loss is the first feature of Alzheimer's disease. They will forget what they have taken in the last night dinner. In the morning breakfast, they will forget what time it is. They will ask for the same thing repeatedly. They will forget once they have taken bath, they will again tell that and I will take bath. So recent memory loss is the most common feature of Alzheimer's disease. The remote memory or the fast memory is relatively spared in Alzheimer's disease. Person will remember their year of matriculation, the year they have passed their high school, the year of marriage, and all those important dates they remember, but they forget the recent memories. The semantic memory is also preserved. The semantic memory is known as the person remembers the name of the first president of India, the capital of India, all those things person remember. That is relatively preserved in Alzheimer's disease. Then as the disease progresses, people have difficulty in path finding. Once they go to the bathroom, instead of coming to the bedroom, they go to the kitchen or any other room. That is very common. Once they go to the market, they have also difficulty to come back to their house. They have path finding difficulty. Next thing is that repeated fluctuation of their memory and also their behavior. Normally they remain apathetic. They do not interact with family members. They remain silent in their home. They do not interact with the children or their son or daughter. They prefer to remain silent. And some people, it is seen that they become agitated. They become very angry and also they scold others. So these behavioral changes are also very common in Alzheimer's disease. But as the disease progresses, the disease becomes so difficult to control that it is very difficult for themselves to wear their own clothes. So they also find it very difficult to do their day-to-day activity like brushing, going to toilet. They remain completely bedbound and completely dependent on their caregiver. Alzheimer's disease is a neurodegenerative disease. So this is not a completely curable disease. This is a treatable disease, but the complete cure is not possible. Even if that is not completely curable, if we detect the disease early, we can definitely prevent or stop the progression of the disease or slow down the progression of the disease. It has been seen that if we will not completely treat the patient, we let the disease to progress as it is, then the person normally becomes bedbound within 1 or 2 years. We will treat the patient, then the persons normally live a normal life up to 5 to 7 years, in some cases up to 10 years. So definitely early diagnosis is the key for the treatment of Alzheimer's disease. Also there are many risk factors that is seen in patients of Alzheimer's disease like hypertension, increased blood pressure, uncontrolled diabetic mellitus, repeated head injury. We have also seen that persons normally consume a lot of alcohol and also they do smoke a lot. If we prevent these risk factors and control the blood pressure, diabetics, and prevent these risk factors, the progression of the disease also slows down. So it has also been seen that it is very common in some of the family members of the Alzheimer's patient. So 20% first degree relatives of Alzheimer's disease patients also suffer from dementia. So if we diagnose these cases in these patients very early and treat accordingly, the disease can be prevented to much extent and they can lead a normal lifespan. The risk factors of Alzheimer's disease has been divided into two parts. Some are modifiable, some are non-modifiable. Age is the non-modifiable risk factor, but coming to the modifiable risk factors, diet is a very important thing in the modifiable risk factors. Persons with Alzheimer's should be advised to take a lot of fiber-rich diet rich in green vegetables. They should avoid fatty food, lot of non-veg food. Persons should be advised to quit smoking completely and they should stop taking alcohol. In some studies, it has been seen that red wine is very helpful for the brain, but people take it in very large amount, so that is also very dangerous for the growth of the brain. So people should stop smoking and should completely avoid alcohol. As I said, Alzheimer's is the non-curable disease. A person if suffers from Alzheimer's disease, he has to suffer lifelong with the same disease. So the family members or the caregiver is the most important in the management of Alzheimer's disease. Those caregivers should be advised and counseled how to manage the Alzheimer's disease patients. First and foremost, their BP, blood pressure, sugar, all those things should be controlled. And a positive atmosphere, healthy atmosphere should be maintained at home. Persons should be advised to interact with family members more. They should not be left alone. Children in the house should be told to interact with them. Then they should be advised to do regular exercise. At least 30 minutes of aerobic exercise daily or 150 minutes of aerobic exercise per week is mandatory for persons with Alzheimer's disease. They should be advised to go for at least morning walk or evening walk, so they can have a normal social life. They can interact with their friends and also they can do some aerobic exercise. As I said, they should eat a normal healthy food rich in green vegetables. Then they should be advised to listen to music at least for 30 minutes a day. Music is a very good therapy for the proper development and proper good health of brain. Patience is the key in the management of Alzheimer's disease. We cannot be impatient while treating Alzheimer's patient because that disease is going to stay forever. So if we'll maintain a negative attitude towards the patient, if we'll mistreat the patient, ill-treat the patient, then the disease will worsen. So we have to be sympathetic for the patient because the patient is unaware of the illness. He doesn't do the things knowingly. So we have to be sympathetic to the patients and maintain a positive atmosphere at home. That is very good for the development of the patient of Alzheimer's disease. Coming to the management of Alzheimer's disease, firstly, early diagnosis and then the treatment is the key in the management of Alzheimer's disease. For the early diagnosis, as we know, history is very important, but apart from history, there are many investigations that are coming up for the early diagnosis of Alzheimer's disease. There are many scans like CT scan, MRI scan, functional scans like PET scan is coming up for the early detection of Alzheimer's disease. By doing a MRI or a functional scan, we can accurately know that which area of brain is not perfectly working and in which we can diagnose Alzheimer's disease. Coming to the treatment, actually acetylcholine receptor is there in the nerve endings that gets depleted in Alzheimer's disease. So one receptor is there that is known as acetylcholine esterase. We have to reduce the level of acetylcholine esterase. So the patient of Alzheimer's disease, the symptoms get better once we deplete this acetylcholine esterase. Many molecules are coming up. Most commonly the used molecules are donepezil, rivastigmine, then memantamine and galantamine. These molecules we commonly prescribe and these molecules have been used for last 2 decades. They are doing very good success in the treatment of management of Alzheimer's disease. Also, there are many new monoclonal antibodies are coming up in the in the treatment of Alzheimer's disease. Those are not marketed yet, but in the future definitely they will come up and we can succeed or we will completely cure Alzheimer's disease. As I said, this year theme is never too early, never too late. So we should detect the Alzheimer's as early as possible. If we detect it in the early stages before this happens, then we can definitely delay the onset of the disease or the progression of the disease. Those people can lead a very normal life for a long term. And even if we detect the disease late, it is never too late. Even if we intervene, if the disease is progressed to such an extent that it is difficult to treat, then also we will treat. Then in those cases also we have seen very good result. So we should always treat Alzheimer's disease. We should never leave it as it is.